Now, good afternoon, Mr. Caskey.
Good afternoon, my lord. Our witness this afternoon is Neil Mathers.
Good afternoon, Mr. Mathers.
Good afternoon, my lord.
Right, when you're ready, Mr. Caskey.
Thank you, my lord. Would you tell the inquiry your full name?
My name's Neil Mathers.
And you've provided, helpfully, a witness statement for the assistance of the inquiry. I think the witness statement has just appeared on the screen. Do you recognise that?
I do.
I think you've signed the witness statement at the end. Before you signed it, had you read it?
Yes.
And are you content that the content of the witness statement is true?
I am.
And do you want the inquiry to take account of all of the witness statement as part of your evidence to it today?
Yes, please do.
For the purposes of our records, the witness statement has a reference number, which you don't need to concern yourself with, but it's SCI WT 0481 and then 5 zeros and a 1. What's your position? Which organisation are you here from? Samaritans?
I work at Samaritans. My job role is Executive Director for Scotland.
Can you tell us a bit about the Samaritans? We probably know what it is, but probably better to hear it from you.
Yeah, Samaritans is a suicide prevention and crisis support charity. We've been working in the UK and Ireland for the last 70 years. Our vision is to ensure fewer lives are lost to suicide, and we do that by tackling inequality and the risk factors that make it more likely that people might take their lives.
Okay, in terms of your own role within, as the Executive Director for Operations for Scotland, you say something about your role in paragraph 7 of the witness statement. And you indicate there what it is that you do, but if you could just tell us what it is that you do.
Yeah, I'm responsible for our operations across Scotland, so that includes research, public policy, influencing campaigns, marketing, communications, service programming and partnership development.
And from paragraph 9 of the witness statement, I see that you are a UK-wide charity.
Yeah, we work across the UK, Republic of Ireland, Channel Isles and Isle of Man.
Don't forget the Isle of Man. How does the organisation structure itself in terms of the different nations or regions that it's involved with?
So the organisation is led by a chief executive and governed by a board of trustees. In Scotland, we have a subcommittee of the Board of Trustees, which is called the Scotland Committee, and that's made up of some existing listening volunteers within our organisation and some co-opted independent experts that support us with our work. The Scotland Committee is responsible for overseeing and having devolved decision-making for public policy, partnership development and influencing within the wider Samaritan strategy.
And at paragraph 11, you say something about the breadth or the geographic spread of the Samaritans in Scotland. Can I just ask you to explain about that and the difference between charities and affiliate branches, branches and affiliate branches?
Yeah, so across the UK and Republic of Ireland, we've got around 200 branches which support the work that we do. Some of those are what we call central charity branches, so they belong to the main charity of Samaritans, and some are what we call affiliate charities, affiliate branches, which are charities in their own right and operate under an agreement with our Samaritan central charity. So in Scotland, we've got 19 branches. 7 of those are within central charity, and the remaining are part of our affiliate branches, and they manage their own affairs and fundraise for their own operational costs.
Okay. Does the organisation have full-time equivalent employees?
Yeah, so we have 300, just over 300 members of staff across the UK and Republic of Ireland. In Scotland, we've got 10 members of staff.
Right. Now, having been through the statement, it seems to me that many of the statistics and information that you provide are UK-wide rather than Scotland-specific, and we're obviously a Scotland-specific inquiry. Is it not possible to disaggregate Scotland out, or are you so inextricably linked?
Unfortunately, it's difficult for us to do that. The main service that we provide is a helpline which is offered 24/7 all year round and is serviced by our volunteers, our 23,000 volunteers across UK and Ireland. That service is managed across the broad spectrum of all 5 nations. So if someone phones the helpline, they could be speaking to any of our trained volunteers anywhere in the country. It's a confidential, anonymous helpline, so we don't record calls, we don't ask people where they're from. So to disaggregate that data would be impossible, really.
So people who make contact with the Samaritans from Scotland won't necessarily be speaking to someone in Scotland, and vice versa.
That's right.
And how, I know that you have a well-known number, I think it's 116 123. Does that, how is it decided where that telephone call is going? Once I dial that number, what's the internal system for working out who picks up the other end of the phone?
So we have a telephone infrastructure that manages all calls coming through and is able to direct callers to the available listener wherever they are. So every volunteer, when they go into a branch to start a shift with us, will log into the system, will make themselves known in the system that they're available, and then the digital technology that we use enables callers to be directed to the person available. That's how it works across the whole country.
I suppose I'm in danger of putting my toe into waters about which I know nothing. I apologise in advance. But I suppose the rationale is that the needs, I've no doubt there are many different needs, but the needs or concerns of people that contact Samaritans through the helpline are not geographically distinct. In other words, the same sort of needs are as likely to occur in Dover as they are in Dundee, and so forth and so on, and therefore it doesn't really matter where the person to whom the call is directed is located, or my role in that.
No, you're right, my lord. The way that the service essentially is a listening service, so we don't provide advice, we don't refer callers to other forms of support, although if asked we do signpost callers to support that they might need. But essentially it's a confidential, non-judgmental listening service, and that's the main function.
And when I phone the Samaritans, as it were, the person I speak to will be a volunteer.
That's right. Yeah.
How many volunteers do you have in Scotland?
In Scotland we have around 1,000 volunteers working across the 19 branches. And some of those are also volunteers working within our prison listener scheme.
Okay, and I'll come on to the the prisoners' listening scheme shortly. Can you tell me what the Scottish budget is for Samaritans?
So to deliver the work that we do across the listening service and through our central charity branches as well as the Scottish operation, I estimate it's about £1.1 million that it costs each year to run that. It is an estimate because, as I've said previously, the listening service is funded and supported across the UK and Republic of Ireland, so there's a proportionate cost that's included within that figure that I've given you for Scotland.
And how many branches do you have in Scotland?
Got 19 branches.
19. And we know in some detail about the impact on many of lockdown. Tell me about the impact of lockdown on the Samaritans.
So for Samaritans, like most organisations, we had to quickly adapt and respond to the restrictions that were brought in at the beginning of the pandemic. So our Samaritans listening volunteers were given key worker status, so that helped enormously in enabling them to be able to go to their branches and provide the listening service and support the shift patterns that we needed to provide. Obviously, the pandemic also affected our volunteer base, and for some, they may well have had to self-isolate for their own protection, or were unable to come into branch. So that did have an impact on our ability to maintain shift patterns as we normally would. We weren't actually, although my statement, if I can make a quick correction, I've said that all 19 branches did remain open. Actually, 17 branches remained open. So there was 2 branches that did have to close during the restrictions, particularly from April 2020 through that first year of the pandemic.
And was that closure as a consequence of the physical size of the premises?
It was a mixture of the physical size and also there were 2 very small branches in terms of numbers of volunteers, so maintaining shift patterns, and it was very difficult during that period.
Right. We've heard a lot from what might be called third sector organisations about introducing systems to facilitate people working from home. Was that something the Samaritans did on any scale?
In Scotland, we maintained the support through the branches in the main. Outside of Scotland, there was the possibility to do that through the NHS helpline that we ran in partnership with NHS England and Wales.
Something else
which we can come back to.
We'll come back to. Your volunteers were physically going into your offices. I understand from the statement that prior to lockdown, you were providing a face-to-face support service. What happened to that?
So that had to stop immediately. And the impact of that was felt long after, really, the restrictions were lifted. We're really only in the last year beginning to offer face-to-face support within our branches, but not all branches have been able to undertake that.
Did you increase the amount of work that you were doing online during the pandemic? We
introduced an online chat service as part of our wider listening service. So the listening service is made up of our 24/7 helpline, which most people know, which is the phone service. We have an email component of that, so people get in touch with us by email and we provide emotional support through written word. And we introduced an online chat service, which another written word service, but in real time. And we also have a letter service, so we have a correspondence branch providing emotional support through the written word through the postal service.
And is the chat function still continuing?
The online chat function is still continuing, and that will become a primary component of the listening service in the future.
And was that something that was introduced at the time of the pandemic?
It was something we were working on before the pandemic, but for obvious reasons became vitally important. It was made available. We also received some funding from Scottish Government to support the development of online chat.
Okay, I'm looking at paragraph 19 now, where you talk about the fact that when the pandemic started, you weren't in post. Right. When was it you started?
I started in post in September 2022.
So at the time of the pandemic, before you were employed, how many staff did the Samaritans have?
At the start of the pandemic, there was 2 members of staff working.
So it moved from 2 to now 10.
That's right.
And how many of those were recruited during the pandemic?
I think most of the new members of staff were recruited in 2022. 1 or 2 may have started in 2021.
And you were recruited in 2022, is that correct?
That's right. Yeah.
Tell me about, looking back on it, reflecting back on the recruitment process, how was that handled in terms of employing new people, including yourself, during the pandemic?
I think it's difficult to comment about how that was handled during the pandemic. By my own experience was that it was very positive. By that time, I was able to meet face to face with those that were recruiting me into the role. Although we have moved to more of a hybrid recruitment model since the pandemic, so we used online tools to be able to interview staff during the pandemic and appoint them to roles. And we continue to do that, but mix it with in-person interviews as well.
Okay. You said earlier that 2 of the branches hadn't functioned during lockdown, and you needed to correct part of your statement. I'm looking at paragraph 20. Is that where the correction needs to be made?
That's right, yeah.
Okay. At 22, you talk about staff being furloughed or remained working throughout the pandemic. I inserted furlough, so correct me if I'm wrong. What happened there?
We didn't furlough any staff other than those working in shops.
Right. And of the 10 staff that you have now, how many of those are shop workers or managers, and how many are involved in the core business of the Samaritans?
In Scotland, all 10 are involved in the core business. We have one Samaritans charity shop in Scotland based in Edinburgh, and that's run by the Edinburgh branch by volunteers.
Volunteers. Okay. So in terms of staffing the organisation, and presumably, and you'll correct me if I'm wrong, I hope, finance for staffing, the period during and just after the pandemic is a period of significant growth for the Samaritans as, if I can put it this way, as a business, rather than as frontline volunteer workers. Yeah. How was that coordinated within the charity?
It was a decision before my time that there was clear opportunities for investment in the Scotland team to take advantage of opportunities to work in partnership, particularly with government, to make suicide prevention a priority and to increase our visibility and our voice in our campaigning in Scotland to support and encourage help seeking and help giving for those who need emotional support. So there was a decision prior to the pandemic to make that investment, but that was boosted through further work to identify areas such as the West Highlands and Skye, where we developed a project where there was higher risks of suicide and where we didn't have any branch support. So to invest some innovation in programming within that area. So we were boosted with funding from Scottish Government through the COVID Transition and Recovery Fund to make that happen.
That's another thing which I'll ask you about. The way that your statement is structured is you provide general information, and then at the end you focus on particular projects that the organisation does, and that's basically the way that I'll do it. Okay. So these are all introductory remarks, and we'll come back to the specific projects. One of the things that one might think as a civilian, if I can put it that way, is that calls to the Samaritans during the pandemic might have increased quite significantly. Is that correct, or did you see something different?
We didn't see an increase in the volume of calls to the listening service during the pandemic. We saw an increase in the volume of calls at particular periods, particularly where there was new restrictions brought in and lockdowns, where there was an increase to volume of calls, particularly late night, early morning. So we saw
you talk about that at
increase.
26. You talk about that being from 2 a.m. to 6 a.m.
Yeah.
being a particularly heavy period
Yeah.
for calls. It wasn't. I was surprised to read that because I thought it might have been just after 6 o'clock when the ministers had just finished speaking to the country, as it were, as happened almost every day. But it was the middle of the night that you saw, your organisation saw a significant shift. Now, in 26, you provide some interesting statistics. 12% increase in calls during that 2 a.m. to 6 a.m. And presumably that's compared to pre-pandemic.
Indeed, yeah.
And for the avoidance of doubt, it's like for like. So it's 12% increase between 2 a.m. and 6 a.m. compared with 2 a.m. and 6 a.m. periods before pandemic.
That's right, my lord.
Yeah, that is interesting.
Mm-hmm. Now, 20...
Well, I suppose I should ask why. Have you any idea?
Do you know why?
I would be speculating, but
yeah.
I think that period of the evening is in the morning is where we might receive calls from people in extreme distress, and so we're seeing that increase during the most severest of lockdowns in that early part of the pandemic. So we could make a comparison that there was an increase in distress over that period.
Of the day?
Yeah.
Because what you seem to be saying, and again, please correct me if I'm wrong, is that there was a significant increase in the volume of calls that you were receiving during that period of time, but there was no overall increase. You know, you receive a certain number of calls every day, and that didn't change, it just shifted within the day.
That's right, yeah. And over the first year of the pandemic, we answered 2.5 million calls over that period.
And Ireland wide.
UK and Ireland wide.
2.5 million.
Yeah. Last year, just to give you a comparison, we answered 3.3 million calls. So the volume of calls has gone up over the last number of years.
And I know you weren't working there at the time, but off the top of your head, we'll find this from other places if we're required to. What was the volume of calls in the year before COVID kicked in?
That's a good question, which I don't have.
You don't have an answer to.
Right,
that's
now.
Fine. One of the places that we might be able to find an answer to that is in the report that you refer to at paragraph 28, where you refer to 1 year on.
Yeah.
Can you just tell us about the 1 year on report?
Sure.
Without going into necessarily the content of it.
So we produced a report 1 year after the restrictions were brought in, and it was a report that did an analysis of the existing caller data that we had. So this is anonymous caller data. We do record some basic information about the types of issues and concerns that callers share with us. We supplemented that with some primary research with our volunteer listeners to get a better sense of what they were hearing on the calls, and with the NHS healthcare worker line also, and then did some primary research to look at more broadly at the other issues that were going on at that time. So we compiled all of that to create the 1 year on report.
And you provide us with some information in relation to that kind of information at paragraph 28. And further down, where you integrate references to COVID into your caller response. Said there were some types of calls where COVID came up and other types of calls where it didn't. Can you tell us about the differentiation?
Yeah, so we saw a strong association with coronavirus concerns in relation to calls around mental ill health, loneliness and isolation, work and study pressures, physical health. So those are concerns that we hear routinely on the line, but during the pandemic, they were strongly associated with worries and concerns about coronavirus.
And at 29, I'll come back to that, but at 29, you say there was a 9% increase in issues of loneliness and isolation in 2020-21 compared to the previous year. So, and you've already drawn COVID in as a factor which arose commonly in calls relating to loneliness and isolation. Is that correct? You also talk about types of calls where coronavirus didn't arise as an issue. You do that in 28. Again, can you tell us a bit about that?
It was something that we observed through the analysis, that there was clear distinction where there were some issues, as I've mentioned, around family, relationship, work, study, health, where coronavirus was a factor. But some of the other areas that can come up on calls around substance misuse, addiction, issues around sexuality or gender concerns, that those weren't strongly associated with concerns around coronavirus at the time.
Okay. And at 31, you talk about a self-help app. Again, tell us about that.
So we launched a self-help app across the UK in the early stages of the pandemic. This could be accessed through our main website or downloaded as a mobile app. And the purpose of it really was to provide another accessible way to provide support to people who might have been struggling during the pandemic. So it had a range of tools, techniques and exercises that people could use to support their self-care.
And does that continue to be available? We've
just made a decision to withdraw the app now just because of declining usage.
Right. Now, the next part, through almost to the end of your, the next part of the witness statement through to the end is really about different projects, as I describe them. I know you don't describe them as projects, and I want to ask you about those in a second. Okay. But I also want to ask you something about, before we do that, about the process by which Samaritans deal with an individual. I'm not asking, you know, what techniques or training and so on that an individual volunteer will receive, but what happens when the volunteer puts the phone down, the call has ended? What follow-up is there? Because you say you don't give advice, you occasionally, or you, when appropriate, signpost. What happens when you put the phone down?
For the listener?
No, for the volunteer.
Caller. For the volunteer. So when the volunteer listener puts the phone down, they will record some basic information about the call that they've listened to. So we have on the system, we've got some standard issues and concerns that have come up and will change from time to time over the course of the service running. And the volunteer will mark which concerns or issues were raised. The length of the call will be recorded also, and that gives us an indication of how long, obviously, a call was needed. And that information goes into the system and has formed the basis of the 1 year on COVID report. So we did an analysis of that caller data.
And is there any follow-up for the volunteer in terms of supporting that individual?
In terms of supporting the volunteer, every volunteer is encouraged to, before they take another call, so if there's any impact on them in terms of what they've listened to, they always work with a peer by their side, and there is always a shift leader available. So if there's any distress caused by that, then they have someone available to be able to listen and to support them. At the end of every shift, there's a mandatory debrief session with the 2 volunteers that have been on shift at that period. That's not optional, and that's in order to protect our volunteers, to make sure that anything that they've heard that evening or morning has been processed, and they can leave the branch not taking that home with them.
You talk about the volunteers at 33 and onwards, and you talk about the training that volunteers get, and a move to make that more online. Can you tell us about that, please?
So we have quite extensive training in place for our listening volunteers, which includes weekly training, which we call core training. It includes mentoring with an experienced Samaritans listener, and then further training before they are able to take calls themselves. It's quite extensive. Pre-pandemic, that was all face-to-face and delivered in branch. When pandemic came in, all of that training had to stop, and it took us about a year to adapt and to provide an online alternative to that. So we set up support for branches to be able to move online, and we also created a training school which is managed across the UK, which gives us extra capacity to manage that training. So we can bring volunteers together, or prospective volunteers together from all parts of the country, and support them through that training in that way, as well as providing the training.
That must have been quite a big change for the organisation, because prospective volunteers in Edinburgh would previously be trained by people in Edinburgh, and you've now moved so that they might be being trained by someone in Aberystwyth or wherever the college is.
We maintain both versions. So, for example, the Edinburgh branch continued to provide training online after that initial pause of a year. But we added to that an additional capacity managed from the centre to be able to support those branches that maybe struggle to provide that online training. So in Scotland, we do have a number of smaller branches with their lower numbers of volunteers. That means it's more difficult to find volunteer leaders to take on that training role. So this is an additional support to branches who may be in that position.
Okay. Paragraph 32, you talk about one of the specific services that you provide, which is a service, as I understand it, for NHS workers. Yeah. Can you tell us about that?
So in England and Wales, we built a partnership with them to offer a listening service for health and social care workers across the NHS. So that was also staffed by our listening volunteers. Some of those volunteers delivered that service remotely from home. And indeed, some of our volunteers in Scotland contributed to the delivery of that service in England and Wales. So I mentioned earlier in our discussion that some of our Scotland volunteers were unable to go into branch for their own health concerns, but we were able to provide an opportunity for some to be able to contribute remotely, unfortunately only for England and Wales healthcare workers.
And one of the things that we've heard on a number of occasions from volunteer organisations is that the number of volunteers increased during the lockdowns. Was that also true for the Samaritans?
We had a lot of interest at the beginning of the pandemic and throughout, of people who wanted to volunteer and lend support. Due to some of the issues and challenges that I've already mentioned in that first year, it meant we weren't able to capitalise on that flood of interest and support that people wanted to give, primarily because we couldn't train them immediately. So we've been, since then, been working through those people who still want to volunteer with us and try to bring them on board.
And at that time, you will have lost a number of volunteers for the reasons you described. People who said, no, I don't want to be coming in to do it any longer. Overall, have the new additions filled the gaps?
I think overall, yes. We've done well, I think, over the last year or two to be able to bring new people through. All of our branches are operating training programs now, and we've got the additional capacity of the training school that I've mentioned. So we are now able to bring new volunteers through into the service. But it remains a priority for us to extend our recruitment and our promotion, and to make our volunteering as accessible as possible to as many groups across Scotland as possible.
I asked about the number of volunteers that you have, and you said the number was around 1,000. Mm-hmm. Has that altered significantly over recent years?
It's remained relatively stable in Scotland. I would say that there is probably a trend slightly downwards in terms of the number of volunteers that we have at branch level. It is a challenge to be able to attract and support volunteers into the listening service. It's a demanding role. We require quite a big commitment from people, and they're giving their time freely for no reward themselves. So we have a lot of interest in the role itself. We have a lot of applications. We put people through training, but we also have a lot of people pulling out at that stage and not committing to the role itself, partly because of the demands that it has.
And so people will start the training and then say, no, this isn't for me.
Yeah.
Okay. You then move on to talk about a specific, another specific, what I've referred to as project, mm-hmm. which is the prisoner listening service at 38. Again, without going through this in particular, can you tell us how that works, or how that worked?
So the Prison Listener Scheme is a scheme operated in Scotland in partnership with the Scottish Prison Service. It's a peer support scheme, so we train people in prison as listeners. They make up part of our volunteer cohort across Scotland, and they provide face-to-face emotional support to other people in prison. They're supported by a dedicated branch, so each prison scheme will have a branch that's attached to them and a team of volunteers that provides that training and support to listeners within the prison community. And
how was that impacted by COVID?
So the Prison Listener Scheme stopped immediately as the lockdown restrictions were brought in. Prison movement was no longer possible. Face-to-face contact wasn't no longer possible, so that had to stop. There are two other channels that are provided for people in prison. The helpline, which the 116123 number, which you mentioned, remained available to prisoners, and Scottish Prison Service provided mobile phones.
And we heard quite a lot about the provision of mobile phones, both from SPS and also from the Prison Officers Association. Okay. So we know about those going in. I take it 116123 was a number that was pre-programmed into the phone, and that prisoners could freely call.
So prisoners could freely call. I can't say it was pre-programmed, but the number was heavily promoted across the prison service. So, and it was free for prisoners to use.
We heard that right, that's fine. I don't need that.
I just add that the third channel is the letter service. So prisoners could also use our letter service to provide emotional support through written word.
Right. At paragraph 43, you talk about a particular relationship with Network Rail. Tell me about that.
So that's a UK partnership between Samaritans and Network Rail. It's funded through Network Rail, and it provides rail staff and contractors with training and support to be able to recognise and respond to people in distress, both within railway stations and in or near railway lines. It also provides what we call post-vention support. So anyone who's witnessed a suicide attempt or a death by suicide, we provide support directly to them to help them with the distress that they may feel as a result.
And the Network Rail fund that?
Network Rail fund that, and in Scotland we work closely with both Network Rail, ScotRail and British Transport Police to support that service.
And again, was that impacted by COVID?
We were able to continue that service throughout COVID, partly because of the key worker status of our volunteers. The rail services were running as well, so we were able to continue to do that work. We did use online more in terms of the training. It was safer and easier to do so, so we brought in that online technology to support the work.
And the next project, as it were, you refer to as Step by Step. Can you tell us about that one?
So Step by Step is, again, a post-vention programme. So it provides support to, in the main, educational establishments, schools, colleges and universities, directly to senior management teams who may be in a position of preparing or thinking about how to respond to a potential suicide, and supporting them in the event that happens. So we have a specially trained group of volunteers across the UK. We have some in Scotland as well. Around 70 volunteers make up that group.
In the UK or in Scotland?
In the UK.
In the UK.
I think we have around 5 or 6 in Scotland. We moved that service onto online very quickly. So we have a dedicated phone number and email address for that service and can respond within hours in the event of any incident.
And is that a proactive service in the sense that do you contact an educational establishment if you hear or read of a suicide in the venue, or do you wait for people to come to you?
We wait for people to come to us. So we don't approach schools, colleges or universities in that event. Primarily, we don't want to be opportunistic around the service or presumptuous that we're needed. We do proactive work in what I'd call preparedness. So we help those institutions with critical incident planning. And that is where we can be a bit more proactive and get in touch and work with those senior management teams. But we wait until they get in touch with us.
And you also talk about facing the future.
So Facing the Future is another service delivered through specially trained volunteers. It's a bereavement support service for those bereaved by suicide. It's a peer support service. Prior to the pandemic, had been delivered in person, facilitated by our listening volunteers, and has since moved to be an online support service, and actually it will probably remain that way because of the feedback that we've had from those that have engaged with the services, that it's working well.
You also talk about at 49 West Highlands and Skye. Tell me about that.
So the West Highlands and Skye project came about partly as a recognition that in rural and remote areas such as the Highlands there was a high rate of suicide. It was also an area where Samaritans didn't have any branches, so we didn't have any existing volunteers. So we devised a range of interventions, one to build awareness across those communities in those remote and rural areas around help seeking and encouraging people to reach out to Samaritans if they needed help, and to make sure that we were building that, I suppose, that credibility with people living in that area. We conducted some research looking at the impact on lone and isolated workers, particularly trying to understand what protected lone and isolated workers working in remote and rural areas, and what could we learn from that and share with other organisations and with government. We delivered training to workplaces and community organisations in helping to build their skills and confidence around conversations with people who may be struggling or in distress. So helping employers understand when somebody might need additional support.
And you, at paragraph 50, identify a number of worker groups that you particularly focused on in that geographic region. Can you tell us about that?
Yeah, so we focused on people who are physically isolated through the work that they do. So, for example, crofting, aquaculture, and so on. Those that were working in more transitory seasonal work. So, for example, in hospitality and tourism, where they may feel isolated within the communities that they live and not have that social network to get the support that they need. And then looking at the high-risk occupations, so particularly blue light organisations, people working within NHS, where there might be professional expectations on their role of always being there for others that might make it a barrier for them reaching out and getting support that they need. So those were broadly the three areas that we looked at.
And at 52, you talk about your learning and development programme. And again, that's, I think, something that you may have referred to previously about training for employers. Tell us about that in a bit more detail, please.
So we delivered around 20 courses and a number of webinars over the last year or so, and that's directed towards small businesses, employers, different workplaces, community organisations that are working to support people within the community. And it was about building skills and confidence around recognising distress, providing a compassionate listening support, and being able to signpost and steer people towards support if they needed that. The feedback from everybody actually on those courses was it was very helpful for them in building their capabilities around that.
Okay, the next part of your report is statistical, in the sense of, can you tell us, was there an increase in suicide rates during the lockdown and pandemic period?
We haven't seen an increase in deaths by suicide during the pandemic. Broadly speaking, over the last 10 years, the rates of suicide in Scotland have remained around the 800 figure, so that we haven't seen a significant impact on that.
So about 800 a year.
Yeah.
You move on to talk about the organisation's relationship with the Scottish Government. Can you tell us a bit about that?
So I've mentioned some of the funding that we've received from Scottish Government for both the listening service, our work in the West Highlands and Skye, and in addition to that, we've been key partners in the development of the National Suicide Prevention Strategy, Creating Hope Together. So we were a member of the National Suicide Prevention Leadership Group up until last year when the new strategy was published. We were then appointed strategic outcome lead for outcome 1 of the strategy, which is focused on ensuring that the environment protects against suicide. So that work is focused on policy development that tackles the inequalities and risk factors that lead to suicide.
And within the organisation, who takes the lead on that?
I take the lead on that.
And do you have others who work with you on it directly? Yes.
Yes, yeah. So I take the lead on that alongside our head of policy and policy manager.
Okay. At 61, you talk about your research and reports, and you talk about a number of reports that you've produced, including a report which you refer to at paragraph 62 as the Social Renewal Advisory Board's report, and then you provide us with a useful summary to that. I've read the whole report, but this is a good summary. Can you tell us, in fact, could you just read 63?
Sure. So the report showed that the mental health impact of COVID-19 was not being felt equally across the population of the UK and will likely exacerbate existing socio-economic inequalities. The impact could lead to worsening mental health outcomes for at-risk groups, including those living in the poorest communities and on the lowest incomes. Our COVID-19 collar research, which was UK-wide and done in 2020, was undertaken in response to concerns raised among our volunteers that the pandemic was causing similar worries among high-risk groups. The research showed an increase in calls to our helpline from men discussing feelings of fear and uncertainty about the future. Job insecurity, fear of job loss and redundancy were also key concerns. Young people experienced a much greater decline in their mental health than others. This was primarily a result of a loss of coping mechanisms, a lack of peer contact, and uncertainty about the future holds in terms of education and employment. Lockdown has exacerbated existing mental health conditions. People were worried about their conditions, that their conditions would worsen as access to mental health services and community support were significantly limited. Failing to address the mental health impact of COVID-19 could lead to worsening levels of mental health and illness among high-risk groups. In effect, this could limit the ability of some groups to participate in the active labour market and hinder Scotland's economic recovery. Poor mental health is a significant barrier to secure employment, and conversely, insecure employment could lead to poor mental health.
Thank you very much for that. That will provide us with assistance in drawing our own conclusions. At 65, we're into a section headed Lessons Learned, and there you have some positive things to say about the Scottish Government in terms of the dealings with you. Do you want to say a bit more about that?
I think our experience, both in terms of working collaboratively with Scottish Government on our West Highlands and Skye project, has been very constructive and positive. We've worked in a way that was about trying to understand what could be done differently and could be improved, and to cascade that learning through that project to influence practice in the future. And Scottish Government wholeheartedly supported and got involved in that area of work. I think the other element to highlight would be the way in which we've worked with them on influencing the strategy for suicide prevention and the role that we now play in trying to lead the delivery of certainly part of that.
And in terms of lessons learned, at paragraph 67, you talk about your newly developed email hub. Tell us about that.
So I mentioned the email service earlier, and indeed during the pandemic we saw an increase of that service by 23%. I think we had around 500,000 contacts through our email service. Partly as a response to that, and to ensure that we were responding timely to those contacts, we created the email hub. So our branches contribute to the email service, but the email hub is a way of being able to recruit volunteers specifically to deliver that service alone, rather than also contributing to the helpline. That was a key focus of our West Highlands and Skye project, so recruiting people from that region where we couldn't offer an opportunity to help us with the helpline, but where we could provide remote working opportunities to contribute to the email hub.
And at paragraph 70, you say we are only now beginning to get the face-to-face part of our service up and running again, and had to work out how we were going to do that safely. Could you tell me a bit about that?
So the face-to-face in branches is now up and running in a lot of branches, but we had to make some physical adaptations. We took the opportunity during the pause where we brought that to a close to look at our service standards around that, make improvements, particularly around safeguarding and protecting our volunteers who provide that service. It's an ad hoc service, so people don't make an appointment. They can just turn up at the door and ask for that support. So that is now up and running, but not in every branch. We also provide face-to-face emotional support in community settings. So many of our branches, immediately as we were able to do so, would go out into public spaces and provide that listening support where people are. That's something that we want to see increased over the next few years. And indeed, my team is looking at how we can target that in West Highlands and Skye particularly. So working alongside community organisations that are trusted by local people and ensuring that emotional support is provided in a place that they feel safe and trusted.
Now, you said earlier in your evidence when you were talking about the prisons that your face-to-face engagement had ended at the time of lockdown. Has that come back?
We're almost back to where we were pre-pandemic. So pre-pandemic we had 19 listener schemes running in Scotland. We now have 17 listener schemes in prisons.
And is it the intention that you'll get back to 19?
It's our intention to grow it beyond that. We feel it's a really vital service. People in prison are a high-risk group in a high-risk setting. So this year we'll be looking to do a evaluation of the listener scheme to better understand its value and impact and look at ways in which we can grow that further.
Okay. Thank you very much. I have one final thing to say to you in a moment, but those are all the questions that I have for you. I hope that I've covered all of the ground that you indicated you wanted covered in your witness statement. Is there anything else of significance that you want to add that I've not asked you about?
No, I think we've covered a great deal.
I just wanted to say, to take your organisation from 2 members of staff to 10 members of staff in the short time you've been there is very impressive.
Thank you.
Yes, thank you, Mr. Mathers. And that's all for today.
That's all for today, my lord.
Thank you, my lord.
Tomorrow morning at 9:45.